Are you or a loved one showing signs of memory loss or confusion? These could be early signs of dementia, a condition that affects millions but often goes unnoticed until it's too late. In today's video, we'll explore the 7 early signs of dementia, dive into advanced symptoms, and share practical tips to prevent or slow the disease. Let's dive in. Firstly, what is dementia? Dementia refers to a group of symptoms affecting cognitive abilities like learning, memory, reasoning, attention, decision-making, problem-solving, and daily tasks. It targets the brain, the center of our identity, skills, and experiences, gradually eroding one's sense of self and reality. Dementia is a neurodegenerative condition where neurons die faster than normal, meaning it's not part of normal aging. You can live long without experiencing memory loss or difficulty keeping track of things. Now, let's mention types of dementia. There are several types of dementia, but the main one is Alzheimer's disease. This is the most common type of dementia, accounting for 60–80% of cases. It is characterized by the gradual deterioration of memory and cognitive function due to the buildup of amyloid plaques and tau tangles in the brain. 2. Vascular dementia. It's the second most common type, caused by conditions that block or reduce blood flow to the brain, leading to brain damage. It often occurs after a stroke or series of strokes. 3. Lewy body dementia, associated with abnormal protein deposits called Lewy bodies in the brain. It causes symptoms similar to Alzheimer's and Parkinson's diseases, including visual hallucinations, movement disorders, and fluctuating cognitive abilities. 4. Frontotemporal dementia, FTD. It's a group of disorders caused by progressive nerve cell loss in the brain's frontal and temporal lobes, affecting personality, behavior, and language. What are the 7 early signs you should watch out for that may indicate that you or a loved one is suffering from dementia? Early signs of dementia can be subtle and vary from person to person, but 7 common are memory loss. The person might frequently forget recent events, names, and places, and repeatedly ask for the same information. 2. The person might find it difficult to perform familiar tasks. For example, the person might struggle with tasks such as cooking, managing finances, or driving to familiar locations. 3. The person might have trouble finding the right words, following conversations, or understanding written and spoken language. You may notice that the person has difficulty finding the right words while talking. They might use a related word that isn't quite correct, such as saying bus instead of car. This difficulty, known as aphasia, was one of the signs Bruce Willis exhibited. He struggled to remember words. This can extend to names, even of people they know well. 4. The person might get lost in familiar places, not knowing the time, date, or even their current location. 5. The person might neglect personal hygiene or dressing inappropriately for the weather. 6. The person might experience rapid mood swings, increased confusion, suspicion, depression, fearfulness, or anxiety, often with no apparent reason. 7. The person might lose interest in hobbies, social activities, or projects they once enjoyed and become more isolated. These signs alone do not necessarily mean a person has dementia, but if multiple signs are present and worsening, it is advisable to consult a healthcare professional for a comprehensive evaluation. Detecting dementia early makes it easier to treat, enabling you to slow its progression and enhance the person's quality of life. Now that you know the early signs and symptoms, let's move to the more advanced symptoms. 10 symptoms of advanced dementia. 1. The person may be unable to recognize close family members, friends, or even oneself in the mirror. They may have significant loss of recent and long-term memory. 2. The person might almost completely lose of ability to speak, difficulty understanding others, and inability to form coherent sentences. 3. The person may experience constant disorientation regarding time, place, and person, confusion about past and present events. 4. The person may experience severe mood swings, agitation, aggression, and significant personality changes. They may be suspicious and paranoid. 5. The person may find it difficult to walk and experience a loss of coordination resulting in frequent falls. Eventually, the person may become bedridden. 6. The person may have a loss of control over bladder and bowel functions, leading to frequent accidents and the need for assistance with toileting. 7. The person may have problems with chewing, swallowing, and the risk of choking. Significant weight loss and malnutrition may occur. 8. Severe changes in sleep patterns, including excessive sleepiness during the day, and restlessness or insomnia at night may occur. 9. The person may see or hear things that aren't there and hold strong beliefs in things that are not true or real. 10. The person may completely rely on caregivers for daily activities such as bathing, dressing, eating, and moving around. What are the causes of dementia? While genetics play a role, lifestyle, diet, and environment significantly influence dementia risk. For example, head trauma increases the risk of dementia. A stroke is also a cause of dementia. A recent study found that over 60% of people who has a stroke experience significant cognitive decline within a year. Circulatory problems like generalized atherosclerosis, carotid plaques increase the risk. Atrial fibrillation without anticoagulant, also excessive alcohol and drug use. Processed foods, nutritional deficiencies like lack of B1 and B12 may increase the risk. Now, how to prevent dementia. While there is no guaranteed way to prevent dementia, there are several strategies that may help reduce the risk or delay its onset. 1. Engaging in regular physical activity can help improve blood flow to the brain, reduce the risk of cardiovascular disease, and promote overall brain health. 2. Eating a balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats, like those found in fish, can support brain health. If you are overweight or obese, it is important to lose weight. Visceral fat inflames your body, which in itself increases the risk of dementia. Avoiding excessive alcohol and sugary foods is also beneficial. 3. Keeping the brain active through activities such as reading, puzzles, learning new skills, or engaging in hobbies can help maintain cognitive function. 4. Maintaining social connections and participating in social activities can support emotional well-being and cognitive health. 5. Getting enough restorative sleep is crucial for overall health, including brain function. Establishing a regular sleep schedule and addressing sleep disorders can help. 6. Controlling conditions like diabetes, hypertension, and high cholesterol through lifestyle changes. 7. Quitting smoking and avoiding exposure to secondhand smoke can help protect against cognitive decline and reduce the risk of dementia. 8. Chronic stress can negatively impact brain health. Techniques such as mindfulness, meditation, yoga, and other stress management strategies can be beneficial. 9. Taking precautions to prevent head injuries, such as using helmets in sports, wearing seat belts, and preventing falls, can help reduce the risk of dementia caused by traumatic brain injury. 10. Maintaining regular visits with healthcare providers can help monitor overall health and identify any potential risk factors for dementia early. While these strategies can contribute to brain health and potentially reduce the risk of dementia, it's important to note that individual factors and genetics also play a role. Consulting with a healthcare provider for personalized advice is advisable for anyone concerned about dementia risk. Thank you for watching this video. Please share it with friends and family to spread awareness. If you have found this information valuable, please give this video a thumbs up. Consider subscribing to our channel for more valuable content. See you next time.